Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19, infection control, and other nursing home-related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Today's webinar topic is managing common infections in nursing homes. We also invite you to join us at next week's webinar, which will be our final webinar in this weekly series. And that webinar will discuss updates for the Quality Insights QIN-QIO as our extended contract period wraps up next week. And if you're interested in joining, that will be the same time and place next Wednesday at 2 p.m. Everyone has entered today's webinar on mute, but we'll have a Q&A following the presentation. If you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. And now I'll introduce our speaker today, Jennifer Brown. Jennifer is a quality improvement specialist and infection preventionist at Quality Insights. She is a registered nurse with over 10 years of experience in a variety of healthcare settings, most recently as Director of Staff Development and Infection Prevention in Long-Term Care. She has also led several quality improvement and infection control initiatives in acute and ambulatory settings. Jen, thank you for joining us again today.
Thank you, Kathy, and welcome everyone. And thank you for joining us today for this session. As we all know, nursing homes provide care to some of the most vulnerable members of our community. So with that comes a tremendous responsibility to protect our residents from infections that can spread quickly and cause some severe outcomes sometimes. So today's session is designed to introduce information and tools needed to manage those common infections effectively. We'll discuss how to identify common infections seen in nursing homes, including their transmission routes and risk factors, describe appropriate infection prevention and control measures, including isolation precautions and environmental cleaning strategies, and apply evidence-based interventions to manage and contain infections, which hopefully will minimize outbreaks and protect our residents and staff. So, as I mentioned, nursing homes are a unique environment where residents often have chronic health conditions and weakened immune systems, making them more vulnerable to infections. Add to that the close living quarters and shared spaces that also contributes to the rapid spread of disease. So it's extremely important to know the common infections that you might see in a nursing home, and then also the importance of early detection, proper interventions, and those isolation measures. So today we'll discuss some of the most common infections. Respiratory illnesses are among the most common and serious infections in nursing homes due to their high transmissibility and potential for severe outcomes, especially among residents that have underlying health conditions. Some common infections include influenza, COVID-19, RSV, and pneumonia. These infections spread through droplets and aerosols, and also through contact with contaminated surfaces. Some of the risk factors include having that shared communal space, the close proximity physically between residents, and also staff moving in between rooms without, proper hand hygiene or PPE changes. Some other things that might contribute to transmission is the inadequate ventilation. So, some key interventions that you might look at when dealing with respiratory pathogens is number one, ensure that your residents and staff are up to date with their vaccines. So, your influenza, COVID-19 vaccine, pneumococcal vaccines, and your RSV vaccines to help stop those vaccine preventable illnesses from becoming a large problem at your facility. Another thing you want to focus on is your hand hygiene, reinforcing the proper hand hygiene techniques and the use of alcohol-based hand sanitizers. You also want to look at PPE use, that consistent and appropriate use of masks, gowns, gloves when it's indicated. And another thing you want to do is isolation. So quickly isolate any confirmed or symptomatic residents and cohort any confirmed cases if you get, a few of them at a time. Another type of infection that we see very commonly is our GI infections. GI infections can spread very quickly in communal settings, leading to severe illnesses sometimes. It may have complications such as severe dehydration, and other things that can be particularly harmful for vulnerable residents. Norovirus in particular can cause widespread outbreaks. We've been seeing them a lot over these past months due to its highly contagious nature. So things like norovirus, C. diff, and also some foodborne illnesses are spread through that fecal oral route. So having focus on hand hygiene is really important. That poor hand hygiene is a great way to, spread it all over the facility from room to room. Another thing that might promote transmission is contaminated food and surfaces that are used in handling food, and also shared bathroom facilities. So key interventions for these types of infection are your cohorting. You want to group any infected residents together to prevent the further spread, and also your hand hygiene. When dealing with GI infections, emphasize the soap and water over hand sanitizer, especially with C. diff. Um, the alcohol-based hand rubs are not going to be effective for that. So emphasize that soap and water hand hygiene. You also want to look at your environmental cleaning as well. So the use of that EPA approved disinfectant that are effective against the GI pathogens that you're dealing with. Another thing you can look at is your PPE, the use of gown and gloves during resident care and when handling any contaminated materials. Another type of infection that we see often is our skin and soft tissue infections. So things like MRSA, scabies, pressure ulcers with secondary infections. Um, you know, they often arise from breaks in the skin barrier or wound care or direct contact with infected individuals or contaminated equipment. These type of infections are spread usually through direct contact or shared equipment and linens, and can also be spread through poor wound management and hygiene. Compromised skin integrity from pressure injuries may also be a risk factor as well. Some of your key interventions will be your contact precautions when dealing with these types of infections, the use of gloves and gowns when providing care. Also, making sure that your wound care protocols follow evidence-based guidelines for wound cleaning and dressing changes. And if possible, where you can, look at some dedicated equipment. So assigning specific equipment to infected residents when possible. So some of the infection control measures and isolation protocols that we have to look at are our isolation and transmission-based precautions. We always want to use standard precautions anytime we're providing resident care. If there's a reasonable risk that you'll come in contact with any blood or bodily fluids over the course of that task, those standard precautions should be used. So you always want to do your hand hygiene with any resident interaction. But if you think that the dressing change or, you know, irrigation can cause splashes, add a face shield to it. And that way you're protected from any potential infectious materials being introduced to your body. So use your hand hygiene, your PPE use. Respiratory etiquette is also very important. And other things included in your standard precautions is safe injection practices, and that applies to all residents. Now, transmission-based precautions are implemented during times of confirmed or suspected infection. So you have someone who is confirmed with influenza or, has symptoms of a particular infection, and there's a reasonable chance that, they may have it. Transmission-based precautions can be implemented. So there's contact isolation that you can use for infections such as MRSA, C. diff, droplet precautions when things are transmitted through respiratory droplets like influenza, RSV, and also we have our airborne precautions for things that are transmitted through the airborne route. So things like tuberculosis or other suspected airborne pathogens, those are the type of things that you want to implement. One of the most wonderful tools that we have in our infection control toolbox is Appendix A, and this is the type and duration of precautions recommended for selected infections and conditions. So this is a resource that the CDC has put out to help guide us when we have a confirmed infection of a particular organism. We can go on this site and look at that pathogen and see what type of transmission-based precaution is recommended, if any. Sometimes it does list standard precaution, that's all is needed. And then how long that precaution should be in place. So, that's a really great resource for everybody to use. If you have a specific organism that you're dealing with at your facility, you can take a look there and see how, what type of precaution you need and how long you need it for. Some other infection control measures when we're dealing with infections is our environmental cleaning and disinfection. So we always want to clean and disinfect our high touch surfaces, such as your doorknobs, your bed rails, multiple times a day. You want to make sure that you're using a EPA registered disinfectant suitable for the specific pathogen and ensure the proper dwell time for disinfectants to be effective. You want to make sure that we are also cleaning and disinfecting any shared equipment. And if there's any times that we have room turnover, making sure that, there's a full cleaning of that room before the new resident gets in there. We also want to make sure that our staff is educated on these common infections and how to handle them. Some other areas to educate our staff and our residents is on hand hygiene compliance, making sure that we are conducting regular training on that, conducting regular training on our infection control protocols, and can also look at providing visual reminders for hand hygiene and PPE use. And encourage residents and families to participate in your infection prevention efforts. So signage and education to residents and their visitors and their family members on respiratory etiquette. And, if they are having symptoms, as a visitor, maybe postponing that visit. And, if, residents are having respiratory issues, using masks and, how to properly do their hand hygiene and things. So things like that can help reinforce the infection control efforts that are going on in the facility. Some other ways to help make sure that your infection control measures are effective and that everyone is educated on them and are completing them effectively is through audit tools. Quality Insights has some audit tools available for download. The links are here for you to access them to help assist with tracking the compliance um, and quality improvement efforts that are going on in the facility. I'd like to thank you all for attending. Now open the floor for any questions. If you need any further resources, also feel free to reach out at the contact information on the screen.
All right, thank you, Jen. In a moment, we'll begin the Q&A portion of this webinar. If anyone has a question or comment, please submit it using either the chat or the Q&A tool in your Zoom menu, or you could also raise your hand if you'd like to ask your question out loud and request to be unmuted. I'd again like to invite everyone to next week's webinar, which will be on updates for the Quality Insights QIN-QIO, and that will be the same time and place next Wednesday at 2 p.m. And again, that will be the final webinar in our Wednesday webinar series. Now I'd like to see if we have any questions, and I'm going to drop in the link to download today's presentation slides if anybody needs a copy. And I don't see any questions, so I think we can get ready to wrap up. Jen, did you have anything you want to add before we close out for today?
Well, I just wanted to thank everyone again for attending today's session and all of the important work that you're doing to keep your residents safe in your infection control efforts. So thank you very much. Reach out if you have any questions or concerns.
Thank you, Jen. I put Jennifer's email in the chat as well if anybody needs to get in touch. And I'm going to go ahead and wrap us up for today. Yes, thank you, Donna. Before we sign off, we'd like to ask everyone here to please answer a short evaluation of today's webinar. It's anonymous and will show us a pop-up as soon as the webinar ends. So if you have a couple minutes to fill that out, we would appreciate it. Jennifer, I'd like to thank you for joining us again this week and for this great presentation. And I'd like to thank everybody here for joining us, and we hope to see you again next week.